Oregon ranks among the most challenged states in the nation for substance abuse, while being among the worst states for access and engagement with care. That's from a 2019 government report detailing the state's shortcomings in dealing with drug abuse. On November 3rd, Oregon voters will decide on a new and controversial approach to dealing with that problem. Should we decriminalize all drugs? America has been fighting a war on drugs since the early 1970s, when then-President Nixon called drug use
America's public enemy number one.
Fast forward to the last decade, and drug use rates have remained mostly unchanged in Oregon. At the same time, a number of places around the world are starting to treat drug use not as a criminal problem, but as a public health issue. Measure 110 would make Oregon the first state in the U.S. to take this new approach. The measure has two main parts. First, it would create a new $57 million fund meant to pay for new addiction recovery centers around the state. The centers would provide 24/7 access to assessment, triage, intervention, and case management. And the money would come from existing taxes on recreational cannabis, some of which would be shifted from schools and existing treatment programs. Second, the measure would change possession of small amounts of controlled substances like cocaine, heroin, and LSD from a misdemeanor to a Class E violation. That means that instead of facing large fines, probation, and potentially jail time, a person caught using drugs would face a $100 fine, which could be waived if they report to one of the newly created treatment centers for a substance abuse assessment. Just to be clear, manufacturing drugs or possessing with intent to distribute to others would still be a crime. And federal drug laws would still apply, though feds rarely get involved with personal possession cases. Supporters of Measure 110 say treating drug use as a medical condition is a more effective and humane approach than putting drug users in jail. A state analysis estimates that convictions for possessing drugs would drop from just over 4,000 in 2019 to less than 400 a year. That's estimated to save the state more than $20 million in the 2021-2023 budget. Some argue this would also help young people avoid a criminal record, which can have knock-on effects for the rest of their lives. Opponents say decriminalizing drugs will remove an important incentive against drug abuse. They argue that many will be able to pay the small fine without seeking treatment, leading to bigger substance problems down the line. Some argue that an alcohol tax would be a better way to fund treatment centers, and that this measure uses Oregon in a larger strategy against the war on drugs rather than being focused on the best way to help people with substance addictions. A number of governments around the world have tried some version of drug decriminalization, but there's no perfect example that can tell us what the exact impacts would be in Oregon. We'd be the first state in the U.S. to try. And that means there's a lot of outside interest in this race. The Yes campaign has spent millions of dollars so far. The majority of that money has come from the Drug Policy Alliance, a national organization based in New York, along with a large donation from Facebook founder Mark Zuckerberg. Locally funded opponents have spent far less by comparison. With so much outside attention on this race, whatever voters decide will have an impact not only in Oregon, but also in the larger conversation around drugs in America.